In the traditional way, the Western medicine, you don't see the whole person. You have a headache. Okay, here is the pill for your headache. And almost everything that we eat have sugar and is so inflammatory and is one of the things that produce obesity, chronic condition, metabolic syndrome, you name it.
You're focusing a lot of this conversation around stem cells specifically around inflammation. Am I incorrect in assuming that what you're saying is inflammation's at the core of a lot of these conditions and diseases?
Uh,
It is really disheartening in this world to get a diagnosis from a doctor. We think it's fact. We think it's the only option that we have, but we actually have much more control and power in our health destiny. And we're reminded of that in this conversation with Dr. Maria, who runs a stem cell clinic here in Mexico. And so, in this conversation where we hear about Dr. Maria and her path to becoming the stem cell expert, we get to see how the path is actually far more in our control and that we have much more power in this space that so often is painted as being one of the most powerless places in our society. I'm excited for you to listen to Dr. Maria, to learn about stem cells, and to feel more power in a place that we've been so powerless before in our health journey and our health destiny. Who are you, Maria?
Let me start in this way. I'm a learning person. I born in a small town in Mexico, come from a big family, very traditional family. I'm very happy that I decided to become a medical doctor. I'm the only one in the family that had that opportunity and fight for that opportunity and rest.
What did it mean to fight for that opportunity?
Remember those days, 16 years old, when I went and asked my mom and my dad, I wanted to be a medical doctor. They told me, it's such a long career. You will not finish, you wanted to get married, have children. And I said, but I want to do it. They told me they were trying to protect me based on their beliefs, right? And based on what they think was normal for them, for a woman.
Was their biggest concern that you just weren't going to be able to have a family and have kids and do that thing? Is that their biggest concern?
I think their biggest concern was that I was not able to finish, and because I want to have kids and then abandon the career of that dream.
That's the traditional way of thinking,
Exactly.
yeah. All right, so you end up in medical school. Are you aware that you're pursuing your dream? Does it feel like you're on the right path? Does it, or what's the sensation then?
Let me tell you, at that time, yes, I was thinking I was in the right path. I want to help people in the traditional way, the Western medicine, the way that I was taught. And I was believing. Then was the point when you start practicing, and only what you give and see is just symptoms. You don't see the whole person. You have a headache. Okay, here is the pill for your headache.
Right, right. So it almost felt like, in a way, you were just like powerless once again.
Exactly, exactly. And that I didn't like it.
Do you have a story that you remember of like a patient or a situation specifically where you were like, oh my God, I'm doing nothing? It's okay if you don't. I just.
Uh, yeah, I remember this old lady with rheumatoid arthritis. You know, rheumatoid arthritis is autoimmune disease. The hands all deformed, a lot of pain, and I was just giving pain medication. Nothing to cure the root cause, nothing to help the immune system.
And had medical school taught you how to repair the immune system at that time?
Not to repair, no, no. They taught us about the immune system, but never taught us how to repair the immune system, how external things can damage our immune system.
Right.
And in this case, food, stress, lack of sleep, you name it.
Yeah.
So they never told us. Just think about food. Right now, I remember the pyramid of the food. I don't know.
Yeah,
if
the
I'm
food
correct.
pyramid. We had
The
it
food
in
pyramid.
the US too.
So if you look at the base, it's just carbohydrate
Like bread and
and
grains.
bread and grains. Sorry, but that is wrong. And that is what I was teaching my patients, unfortunately.
Okay, so you reach a point, you're kind of getting frustrated. You realize once again you're in this powerless state. You're just treating symptoms, and then kind of like, okay, so you have that awareness, but then how do you go from awareness to then changing what you're doing?
I love that question, Andres. I was doing research for 3 different big medical device industry, and one of them moved me to the US. That was eye-opening. I got the opportunity to know all the healthcare system in the world.
Wow.
The US, Germany, Japan, China, Canada.
You
So
weren't seeing patients though.
I was not
You were
seeing
learning about like health systems.
healthcare system, epidemiology, public health,
Wow.
to help those companies to do strategies.
Yeah.
And me being as a physician, thinking as a physician, that opened the doors, I think, on that business. And when I moved to the US, I started gaining weight.
You started gaining weight.
Yeah,
Okay. Yeah.
exactly. No exercising. I changed food. I have to tell you that for easy and simple and quickly, I was getting these boxes that you frozen of food
Yeah, yeah.
and eating them. For 1 year was no big issue. And also I was craving sugar.
Craving sugar.
Uh-huh.
Huh.
So that was my personal experience. Growing in a small town, in a farm, where I grew up helping mom and dad to bring our food to the table. Like, Maria, could you go and get the eggs? So having that experience being young, getting frustrated with the Western medicine, moving to the US where I saw how food had changed more even than in Mexico at that time.
So all of this is coming together for you to then realize that something needed to change.
Exactly. And I met my ex-husband there in Minnesota. He was in a very bad car accident. And I get to know and feel and live how the healthcare system work. Him going to multiple doctors. All specialties saw him. Was at the point that they told him, nothing that we can do. You need to learn how to live with this. He was not able, Andres, to surf, ski. His ear was popping. When he explained to me about ear popping, Maria, imagine when you are on the plane and your ears pop. But in my case, are popping more than 200 times in a minute.
No. Wow. Okay. So he's real desperate for help here.
Yep. Headache every single day. Not able to drive at night because the light was too bad for him.
Got it.
So his quality of life was impacted, and as well mine, right?
Yeah, obviously.
So all these things
Right.
make
Like,
me think
yeah,
differently. And
man, you just need one experience with the American health system and to get frustrated how hard it is to actually make something happen, to get your insurance to pay for something, to get a doctor to tell you some real answers. It can be so frustrating, powerless, and disheartening. But okay, back to you. We are in the point where something has to change
right?
because you see it in your personal life, you see it with your loved ones, you see it in your own training, you see it with your new job where you're exposed to different health care systems, and you're like, okay, and you compare it to your upbringing in Mexico and you're like, okay, enough of this.
Yep. That was the point where my husband at that time, he said, I look at the stem cells.
He said that?
He said that to me. At that time, I forgot about the stem cells. But Andres, my thesis, when I was finishing my medical career, my thesis was in stem cells, but in animals, in rabbits. At that point, I said, why I'm doing this research when I'm going to be using it? Was in rabbit,
What year is this that you did your thesis?
2005.
Yeah, like stem cells weren't a thing then.
No. These stem cells that we were growing and using in rabbits was for bone.
Oh, the bone.
Yeah,
Got
sorry,
it. Sorry, no, my bad. Yeah. Okay. A defect in the bone. That's what the stem cells were for. Gotcha.
Exactly. So when I was making a defect in the scalp of the rabbit, we took some blood from the rabbit and bone marrow, and the engineer was growing the osteoblast. That is the stem cell for bone.
Mm-hmm.
And then we put it in the defect in the hole that I created, and 4 months later, bring it to the X-ray to see if bone was formed. Bone was formed.
So the stem cells worked in your thesis.
Yeah,
The bone that had been removed, or the scalp, this part of the scalp that had been removed from the rabbit,
was
grew back.
was
Okay.
close.
So you already had proof with your own hands.
Yeah, exactly. But
You had forgot.
I didn't know, Andres, at that time. I didn't know
Yeah.
how to use it. I was so young at that time, and was with the goal to become a doctor to help patients.
Right. That's how we think about being a doctor. How could you think of any other way?
Yeah.
Right.
So, and my husband at that time told me, I'm going to do stem cells. I said, wait a minute. Immediately come up to me, stem cells is approved? Yeah, it is approved in Mexico, in some countries in South America, other countries in Europe. And Andres, I start researching. Can I get stem cells? Where can I get training?
Oh, so you were trying to help your husband at the time.
Yeah.
Interesting. And then you thought about it so that you started thinking about the training so that you could help him, or
Yep.
wow. Okay.
Yeah, exactly. I cannot imagine how much he was suffering really
Yeah.
of this car accident that he had. So we decide to do stem cells. At the beginning, nothing was happening, but 6 months later, were happening. But at the same time, Andres, I was learning about diet, changing habit. How important is that for our health? Because I have to say, it doesn't matter that you use all the millions of stem cells if you don't change your lifestyle.
Yeah, like you're coming to yeah, I mean it makes sense. Like you're now moving from the Western medicine thinking into this new way of thinking, which requires a more holistic way of thinking. You can't just think that one solution is going to solve all your problems, but one solution won't solve all of your problems, right?
Exactly, correct.
And so okay, so your ex-husband does the stem cells. You're learning about diet, and so your husband at the time starts to feel and see. You start to see differences in him.
Yeah, I started seeing differences. What's the point that he said, I'm going to ski.
To ski.
Uh-huh. He was very good skier. You know, he was in the U.S. junior ski team. So he loved it. That was his passion.
Wow.
And I said, great. He nailed it. He was feeling good. And planning other trips to ski. Then start surfing.
So it's like he got his life back.
Yeah, he got his life back.
And you got confirmation once again that stem cells worked.
Exactly. Yeah, but now with different eyes.
Yeah.
Different eyes that in the past.
I think it's so cool and different as a doctor in many ways because that career is so structured that you allowed yourself to have life experiences change your path.
Right.
Because I think a lot of doctors get into the mindset that you have to that your life has to be in this linear kind of way, and you had the ability to question your own path to allow for what was happening in your life to influence your own career.
Exactly.
And that's really beautiful. Like that open-mindedness is unheard of.
Yeah, my own experiences, you know, and I think everything was needed.
You're now full on practicing with stem cells. You have a company and business called Biostem Health.
Yep.
And yeah, let's talk about stem cells. And then I do want to back into, because like you said, it's not just about stem cells, it's about a more holistic approach.
Yep.
But I do think it's important that we ground what stem cells are and what's so special about the type of stem cells you can work with in Mexico.
Talking about first, what is the type of stem cells that I use. They are called mesenchymal stem cells.
Say it one more time.
Mesenchymal
Mesenchymal
stem cells.
stem cells.
I'm not working with embryonic stem cells.
Mm.
So embryonic has a lot of ethical issues.
Okay.
They could work. They work very good, but they could generate cancer, teratomas, so things that we don't want.
Because they don't know yet how to use them properly, or because they're always going to do that?
I don't know if sometimes can be modified that, but right now nothing has been possible to stop that. So I don't work with embryonic. I work with mesenchymal stem cells that are undifferentiated. And they could come from umbilical cordon, from placenta, and also could come from your own tissue, your own fat, your own blood. And these two types could be stem cells coming from your own body, that we can get some samples and create the stem cells that come from your body.
Is that just from like spinning my blood and taking out the plasma?
No, that is plasma.
Oh, that's different.
That is different. If we decide to get the stem cells, let's say for Andres, we can get some fat tissue and do all the engineer in a lab and get the stem cells specifically for you. Or get the bone marrow and send it to the lab and use the engineer process to get the stem cells. Those are called autologous, so means are your own stem cells.
Got it. That's one type.
Yeah. The other ones could be exogenous.
Exogenous, yeah.
Like Maria is the donor, and we'll give it to Andres.
Got it. And in those cases, you usually choose like younger donors, right?
Right.
Because the idea is that the younger the stem cells are, the more effective they're going to be.
Exactly. If you have a lot of chronic conditions, why we should go and get Andres samples to get the stem cells? We wanted younger, healthier patients.
Yeah. Okay. I think I understand that. I think I need to go back a second though, because what are stem cells in the first place? And you know what? Maybe I'll try to explain what I think stem cells are, and you'll correct me. I have this idea that stem cells are essentially like your original cells, and that over time those original cells, they age, and the types of cells that your body starts to produce over and over again are the aged cells. And so you need to go back, or you want to go back in time and insert the unaged original cells into your body, something like that. That's how I think of it.
No, your body will have, if you have some cells, if you have the stem cells, will be good cells, right? But when we put it exogenous, we wanted to make sure that come from younger and healthier patients, just to make sure that we are getting good quality. But your stem cells that you have now are good. And let's say if you have a disease, they are going to go and fight and trying to help you. Because when you have a disease, it's an inflammation, and stem cells reduce inflammation in your body. So when patient has so many chronic conditions or autoimmune disease that is a lot of inflammation in the body, we put stem cells to help them to heal and reduce inflammation, because the stem cells produce cytokines or growth factor, exosomes that are able to reduce the inflammation in your body.
Got it. Okay. So it's not like your body starts to, like if I insert exogenous stem cells inside of me, it's not like then my cells are going to start producing other stem cells like the one that you've put inside. It's just that those stem cells will activate certain chemicals inside of me that will reduce inflammation and
produce all cytokines, growth factor, exosomes, you name it, all the chemical things.
Is it a temporary solution, like where you need to then insert stem cells again? Or once you insert stem cells once, your body will produce them over an extended period of time?
I've been seeing, this is a very interesting question, because I've been seeing cases that my patient doesn't need a second dosage. But I see in other patients that, yeah, they do, but we put it a small dosage just for maintenance. And I think this is related at what stage of the disease they come. or they get it. I have a case, a patient that was having arthrosis on his knees. He was about to get knee replacement. And he came and see me, and we did the stem cell injected in the knee joint. And came again, like a year later, he was feeling better. And his orthopedic back in Canada, he wrote me a very nice message and telling him, go and do another stem cells because your knee have improved a lot. I don't think that is we should do knee replacement at this time.
Wow.
So he has been here 3 times. So it depends.
Okay. Okay. One thing that I think my mind is being blown about is you're focusing a lot of this conversation around stem cells specifically around inflammation.
Yeah.
Am I like incorrect in assuming that what you're saying is that like inflammation's at the core of a lot of these conditions and diseases?
One, to answer that question, yes, some of that, yes, inflammation, but as well, repair.
I see. And maybe you can't actually get to repair if you have inflammation around
Exactly.
a specific site.
Exactly. If it's inflammation, if you reduce the inflammation, the pains go away. And when you have torn labrum, and if you put it in stem cells, that heal and repair. Cartilage, like that patient that I was telling you, he was almost all the cartilage gone, ready to be getting knee replacement. And he tried it, and stem cells repair.
I'm curious if I don't know if this is how to ask this, but it's either philosophical or potentially spiritual. I don't know. But do you think somehow that using stem cells contributes to or takes away from the idea that your own body has the ability to heal itself?
The own body has lose the ability to heal itself.
well-
So help me to understand that question a little bit more.
So I think a lot of times in some of the alternative medical thinking is that we humans need to get out of our own way because our bodies have the capacity to heal themselves. But we often add external factors, whether it's our environment or food or whatever, or drugs or alcohol, and we prevent actually the ability for our body to heal itself.
Yeah, start the point that the body is not able to heal because you already have done too much damage. And see the point that stem cells can be good, but are not just stem cells, as I said, Andres.
Yeah.
For your body to get recovered, we need to change life of styles.
Yeah.
And
Right.
sugar is so addictive, and almost everything that we eat have sugar, and it's so inflammatory, and it's one of the things that produce obesity, chronic condition, metabolic syndrome, you name it.
Yeah. So, all right, let's talk about sugar.
Alcohol,
All the stuff.
all that kind of stuff.
Yeah, but it's so delicious.
I told you, it's so addictive, more addictive than cocaine. And you feel happy when you eat it.
Yeah.
And after that, you feel bad.
Interesting. So what are we supposed to do? What do you think about these guys that are, I say guys because I'm thinking specifically of Brian Johnson. Have you been paying attention to him at all? And longevity, kind of like this pursuit of longevity. How does that fit into your way of thinking? And when you see them online, what do those personas kind of represent for you?
I think their approach is similar to what I'm thinking. I learn from them. They are big, and I read their stuff, what I think, and based on scientific things, I take it and use it. Like Peter Attia.
I love Peter Attia.
Yeah, I think he nailed it good, and I like his stuff. I read his book, his papers, and
Yeah, I think what I like about Peter Attia versus, say, Brian Johnson's, I feel like his threshold for what is appropriate to do to his patients is higher, meaning he won't pass on a treatment unless he has certainty, or at least he has certainty that it won't harm, and he has at least an above average sense that it could really help.
Yeah, exactly. I'm a lot to that ideology. That is my philosophy. If we see that is will not hurt, let's do it.
Yeah. Yeah. Because sometimes I think, like, for example, I saw the Brian Johnson documentary. I don't know if you've gotten a chance to see it. It's called Don't Die. It's on Netflix. It's pretty good. But he goes, and I think he goes to Honduras and does the CRISPR gene editing thing. And I think even on the documentary, they talk about how that's not really necessarily yet been proven science and might even have some not negative, but unknown effects.
Yeah.
So I wonder how you, actually, I should ask you, do you consider yourself a longevity doctor?
I consider a longevity doctor and focus on prevention.
Got it.
I think many of the chronic disease can be prevented, and we are not doing nothing for that. And I use stem cells for prevent that. It's not just stem cells. Again, this is my point.
Yes.
It's a holistic approach.
What other components are an important part of your practice?
So hormone therapy replacement and nutrition, very important.
Yeah, I mean, I wonder, though, it's hard, though, to get people to change their lifestyle because a lot of that has to do with, I don't know, like habits and mindset. Like, I mean, the friend that you saw he's a trainer, he's a coach, and he's told me countless of times it's really hard to change people that aren't ready to change.
Right? Yeah. Exactly. That is the big issue. But if they are expending that money, I need to be honest and transparent with them. And I'm not trying to say that they need to stop drinking. Just if you were drinking a bottle of vodka every day,
Yeah.
hello.
That's not going to work. It's not going to work.
Yeah.
It doesn't matter how much stem cells or exosomes.
Exactly. If
Yeah.
you just eating sugar and not exercising every day, so Andres, no way that we can help.
Yeah.
And I think this is going through to politics here because regulation need to happen about our food.
Regulation should happen about our food?
Yeah.
Because here you're saying, I mean, now this is not a political thing, but you're saying people can't be trusted on their own to make the right decisions?
Yeah.
Or are you saying that something in our food system has specifically made people addicted to these other chemicals and sugar that makes it hard for people to make the right decisions for themselves?
Exactly. That is the second
Okay.
one. The second one. So because they are adding to everything sugar. If you look at the skim milk.
Skim milk, yeah.
The diet milk. They put it out all the good fat and they add sugar.
Right.
So to taste good. And it's poison. They're poisoning us. All the things that they're putting in candies for kids, in our normal food, Andres, if you read the labels, everything has sugar added.
How did this happen?
I think they have a lot of financial interest.
Yeah.
And I think, I don't know, I would say it, but pharmaceutical companies and the food industry, they are working together.
Yeah, they told us in America, in the U.S., we call it the Food and Drug Administration. They had already told us that.
Yeah. So, and I don't want to get too much into that topic.
Okay, yeah, I get it.
But I feel like something need to happen in our for regulation on that, on the food.
Yeah, I mean, I understand, by the way, your desire not to say something because you're in that world, and I get that. But I feel like, I don't know, there's a part of me that's really angry.
Yeah.
Because there's been like a whole systematic way in which people have been taken away from the ability to make their own choices in life. And it feels like an uphill battle because of those financial incentives. And I think we should be angry. That's my
No, absolutely. We should be angry, and hopefully the government start doing something to change that. But if you look at what the food industry is doing, is making the people obese, diabetes, hypertension, all the chronic condition, and the pharmaceutical companies just creating pills to treat symptoms.
So I, like you, don't like to talk about politics. And the reason why is because I don't think that we should ever look to our governments to solve our problem.
Yeah,
Like, we should take some of the control back.
right.
So how do we do that?
Awareness,
Okay.
education. I think the youngest generation, they need to start knowing this. And unfortunately, social media is could be good and bad.
Yeah.
But I think awareness, Andres, and work with our youngest generation and also with the parents, not just them. It's a lot of work to do.
I tried doing keto, and I did. I lost a lot of weight on it, but it wasn't sustainable for me. And I think, do you think about how to phrase, or not phrase, but frame the protocols you give people in terms of sustainability and their own ability to stay consistent with them?
Yes, I think it is very important. You have a social life, right? And when you are doing your social life, enjoy that time. But then realize, come back and thinking about your health. And I'm not telling you that if you go to a party and they don't have what you eat, well, eat what you can at that time, but you come back next day.
Yeah,
You know?
come back. That it's
Come-
not, yeah, I think that's a good point. I think we often think, oh, I ruined my diet, so it's over
It's
now.
over, and then you continue and continue because it's a cycle. Because it's hard to broken because it's addictive what you ate. You ate the cake, next day you are craving again another cake, and I prove it by myself.
You proved it by yourself.
And I'm saying, and also drink. I think if I'm going to drink, I'm going to drink good stuff. Why I should be putting something that is not good and it's going to be damaging my body? So I choose a good wine or a good tequila, and but it's not every day.
It's not every day.
It's not every day. I have life.
Yeah.
I have need to have fun. Everybody needs to have fun.
Yeah.
But I'm conscious about my health.
I think one thing I wanted to ask you about was I was kind of getting there with the Brian Johnson and the longevity stuff. Do you think it's okay? I don't know. Like, I wonder if many of our desires for longevity come from a fear of death. Do you ever think about that
The way
idea?
that I've been seeing is patients wanting to continue enjoying life. It's no fear to death. I think they wanted to have good quality of life. Continue living longer and living miserable. Why?
Yeah.
So I think in my practice, what I see in my patients, say they wanted to be able to do in a sport, being able to enjoy life, not having pain. I don't know. Did I answer your question?
Oh, you answered the question. Yeah, you said it's not about the fear of death. It's about living life better for a longer period of time.
Yeah.
So my last question that I like to ask is, what's a question you wish other people would ask themselves?
Be curious. Always, I would say to younger generation, be curious and question everything that you don't know.
So what's the question that you would ask them to ask themselves? I like that.
Okay, so maybe I didn't cut it, what you said.
No, it's a complicated question because I think we're always asking the question of, like, what's one thing you would pass on to the next generation, and I hear that. But I think for me, because I care a lot about people retaining their own power, the question comes from that desire to have them ask themselves a question, because ultimately that will allow them to be in control of their own journey.
What do you want it to improve
What do you want to improve
in terms of health
for yourself?
for yourself? That would be my
I like
my
that.
question.
I like that.
Did I answer right?
You answered it. You answered it perfectly. Yeah, and even the first answer was great too, because I think it is important for people to be curious and to question things. So, I'm with you.
Thank you, Andres. That has been such a nice conversation. I like it.
Yeah. Thanks for all that you do.